When you think self-care, what comes to mind? Most would say having a healthy lifestyle, which would include a balanced diet and regular exercise. Others might say having proper hygiene or having hobbies that help reduce with stress. One often key piece of self-care that is often bypassed is knowing how to perform routine monthly self breast exams. It is important for healthcare professionals to be discussing and educating patients on the benefits of performing monthly self breast exams at home in order to help detect early signs and symptoms of breast cancer. According to Breast Cancer Facts and Figures of 2017-2018 by Atlanta American Cancer Society Incorporated, the prognosis of invasive breast cancer is strongly influenced by the stage of the disease, that is, the extent or spread of the cancer when it is first diagnosed. Therefore, early detection can result in early diagnosis, which has a huge impact on the prognosis and treatment options for the patient. Instruction regarding the performance of routine breast examinations may result in early detection of breast cancer and therefore a markedly improved prognosis for the patient. Lori Kelly McCory and Jeff Mason, 2017. Not only should healthcare professionals be educating patients on the benefits, but also educating patients on how to perform a self-breast exam, as well as the signs and symptoms to be aware of while performing the self-breast exam. Through routine self-breast exams, patients become more familiar with their bodies and are able to detect changes that may occur and or signs or symptoms that would require a look from a healthcare professional, resulting in a possible diagnosis of early stages of breast cancer, which could result in a better prognosis. This leads into my proposal of creating an educational document handout with visual instructions on how to prepare and properly complete the steps of a thorough breast self-exam to help aid healthcare professionals with educating patients. Not only will the document help healthcare professional educate patients, but it will also benefit our patients by refreshing their memory when they are ready to begin their self-care at home. The handout document would include visual aids as well as written instructions and tips and signs and symptoms to be aware of. Furthermore, the document will include will also have the option of being provided as a digital copy to our patients or a written paper copy, written handout, depending on our patient's preference. If we create this handout as a PDF file, it really has absolutely no additional cost to our office, but it has an invaluable amount of information for our patients to help with their self-care. Patients who are educated and understand the value of breast self-exams are more likely to perform them at home, which will help them become more familiar with their own bodies and recognize what is normal and what should be brought to the attention of their healthcare provider. Breast self-exams will better help healthcare providers with early detection of breast cancer, and with early detection, patients have a much better prognosis. Thank you so much for your time. This is Pollyanna Garcia.